Your help is needed at a critical time to protect our nation's blood supply. Joining us with more on how you can help is Josh Murray, the Regional Communications Coordinator for the American Red Cross of Nebraska and Iowa. Josh, just how critical is that need for blood donations right now?
We're getting to that critical level. We've seen over the last month, we're down about 20,000 units nationally than what we usually collect this time of year. The bigger concern is as we look at the weeks forward, our appointment levels are trending low compared to where they usually are at this time. So if we continue to see that low number and the turnout is low, we're going to have more issues on our hands, see that shortage possibility come up. We're really encouraging people to find time to get out and help us make sure we can avoid that shortage.
Josh, where does summer rank in the need for blood donations, and what are some reasons those needs increase?
Really, there are 2 times a year we really see a decrease. Winter, right in the heart of winter, when you've got illnesses, we got weather issues, we've got holidays in the mix there. And then summer is a tough time for us, largely because of people are traveling, they're going to their kids' ball games, they're working in the field, they're doing a lot of other activities that don't include giving blood. That kind of falls off the calendar sometimes. We also see the increase in the demand for blood that time because there are more people traveling, which means more accidents. There are more outdoor activities, which sometimes means more injuries, and more people need that blood. Yeah, that, and then the lack of people showing up to blood, it's a major concern for us. We see it normally this time of year, but already kind of hitting into this with the last month, as we head into the summer, already at the low point, it has us more concerned.
Josh, in case someone is reluctant to give blood for that first time, does the Red Cross kind of help out by taking some steps to ease someone into that first-time blood donation?
Yes, absolutely. Our staff understands that some people aren't comfortable in this situation, and they'll make sure everyone's comfortable. They're going to help you get set up. They're going to get you water, get you in a comfortable position, take care of you. It's usually that little needle stick at the start that people don't like. I don't think that it hurts. It may be just a bit uncomfortable for a quick second. And then after that, hopefully everything is smooth running there. Our staff understands that. They know that. They're careful about it. They're going to keep a close eye on you if you need anything to make sure you're well taken care of. Just make it an easy process for you. We want you to come back. So if you have a bad experience, that may not lead you to come back. So we're going to make you do everything we can to make sure you feel well and you're on your way out the door and looking forward to coming back again.
Talking right now with Josh Murray of the American Red Cross on how you can help out with the critical need for blood donations. Josh, the rest of this month, there is an extra incentive to donate blood. Talk about that incentive, how it works, and where someone can find more information.
Yeah, we often do these incentives, and the big thing part of it is just a thank you to those who come out and give and help us provide that blood to patients who need it. Now, through the end of the month, you will receive, if you show up to give blood, a $15 e-gift card to a merchant of your choice. So we got a list of several merchants from retail to restaurants to other services and goods that you can select from to get a $15 e-gift card. So what happens once you make your appointment, you show up to donate. After that, you'll receive an email. You'll be able to select the merchant you want, and then you will receive the gift card via email. Good opportunity, again, just a way for us to say thank you. Thank you for taking that time. Thank you for helping us make sure that blood is available in the hospitals.
Josh, who of us can donate blood, and are there any certain types that are needed more?
So the basic eligibility requirements for people giving blood is to be 16 years of age and weigh 110 pounds. Now, after that, there are several things we have to kind of check on. What kind of medication are you on? Are you under treatment? Sometimes there's some travel restrictions that we have to look at. But what I like to tell everybody is to go to redcrossblood.org and you can find it. There's an eligibility tab. You can read about that there. A lot of people assume, I take XYZ medicine or I've been on this treatment while I probably can't give, and they don't. But in many cases, you can. So please check that out. We don't want you to lose that opportunity to give if you are eligible. So again, redcrossblood.org will find all that. All blood types are needed, especially type O. We'll throw type O in, the one that we are probably putting a little bit urgent push to. O positive is the most common blood type. Obviously, that's used a lot. O negative is the universal type. So if they need, and they don't have time to check someone's blood type, they're going to reach for O negative. So those two, we do see that go through a lot. So definitely type O. But if you're not type O, don't think you don't need to give. We do need other blood types as well.
How often, Josh, can someone donate blood or platelets?
Whole blood donation, you can do that every 56 days. So I often tell people just think about it every 2 months. If you get on that rotation, so many people do. Every 2 months they come in and you can give that whole blood donation. Platelets is a different thing. You can give that every 7 days. Now there's a limit to how many times a year you can give that, but it's every 7 days. So about once a week you can give that. And platelets are what we provide to hospitals and used largely for cancer patients as they go through treatments. They often see their platelet levels drop. Again, 56 days for whole blood and 7 days for platelets.
Josh, what is the best way for someone to find a location near them to donate blood and also make an appointment?
You can call 1-800-RED-CROSS, or you can go to redcrossblood.org. Both those places, you'll provide your zip code, and it will pull up all of the blood drives happening in your area over the next several weeks. You'll be able to find the location that works for you, the day that works for you, the time works for you. Make an appointment right there, and they'll make it easy for you. So again, 1-800-RED-CROSS or redcrossblood.org.
Thank you very much for joining us, Josh. That's Regional Communications Coordinator Josh Murray of the American Red Cross of Nebraska and Iowa, talking about what you can do to help increase blood donations during a critical time. For more, once again, you can visit redcrossblood.org or call 1-800-RED-CROSS. Again, that's redcrossblood.org, or you can call 1-800-RED-CROSS. I'm Paul Perkins on the Rural Radio Network.